I want to chat with you for a moment about Facebook introducing new COVID-19 misinformation community standards, releasing the list of criteria that they're going to use to determine posts need to be removed. One cannot discuss this on Facebook. You must be punished. They put forward about half a dozen new rules, and I want to bring up just two of them for you right now. One of them is that they're going to remove posts of people who are claiming that coronavirus is no worse than the flu. And they just put that right there. That's the description. And I go, oh, okay, all right, interesting. And then I think back to how I got a letter just the other week from over 100 doctors in Canada who say kids need to go back to school. And about at least a third of these were pediatricians and high-ranking people from places like Sick Kids Hospital and so forth. And one of the arguments they make in this letter is because coronavirus is less severe than the flu in children. That is the conclusion that they have come to. Now, they're not saying it about elderly and so forth, and I imagine these doctors would say that coronavirus is much more severe in the elderly than influenza, but I don't know. There they have a sentence where they're kind of violating these Facebook guidelines. Is that doctor's letter going to be taken down? I don't know. It just seems pretty rigid and unyielding. This is kind of the problem when you start talking about policing things that are about a medical issue, which is continually changing and evolving. People are still learning things about it, and medical researchers are stepping forward with their different nuanced thoughts. Okay, speaking of nuance, so one of the other restrictions that Facebook has put forward that I want to talk about is they say they're going to remove posts about people who claim that the number of deaths is actually lower than the official statistics, and or they call for more context and more information about those deaths. This is a really bizarre rule. Now, I know there's a lot of people who talk about how exactly are coronavirus deaths counted and so forth, and I would just like to submit to you one item that came from a Statistics Canada report that was released the other month. And Statistics Canada researchers looked at all the provincial data in Canada, and they concluded that 8% of coronavirus deaths are actually not at all coronavirus deaths. They are cancer deaths or people who have been in other accidents and so forth who have completely died of other things, but they just happen to have tested positive for coronavirus at the time of their death, which is how they made their way into these statistics. Now, again, I don't know about the nuance of Facebook's rule. It seems like, a pretty blunt sentence there. Is a Statistics Canada report, is quoting from that Stats Canada report that says, well, actually 8% of these tallies that you see up on the main federal government website about total coronavirus deaths, 8% of those deaths, they're not actually coronavirus deaths. So we can take off, a few hundred in all of that. That seems to be against Facebook's rule. So I think this whole thing, these two examples I give, just show this idea that when you have this emerging issue that this tech giant says, well, we're going to step in and we're going to police how you talk about it, you find yourselves not just potentially saying we've got to shut down the right to speech from someone who wants to put forward an outright conspiracy theory that we all agree is just plain wrong, but you can also find that you're actually punishing people who are experts in that very issue who are trying to have nuanced conversations. I think we've really got to pause and ask some questions about these sort of rules and guidelines that are being put forward from some organization, or I don't know who at Facebook came up with this idea that they actually think they 100% know what's going on and can craft these rules, but they actually don't know what's going on. There's a lot of nuance out there, and they are the ones who are actually completely ignorant of it, and perhaps they are even the ones who are peddling the misinformation.